Good evening, fellow Kenyans and for the state. My name is Joachim Simiyu, and I am here to make a few comments about some happenings that have taken place in this country recently concerning the hospital in Isli called Abyan Hospital. Their story was aired in one of the media stations in this country, and upon following on the story, I made discoveries that the airing of the story about that hospital was very one-sided. Therefore, I am here in an attempt to try and provide an avenue for Kenyans to get to understand the story on how things went. And I was approached by I had a conversation with the owners of the hospital, and the following are the details I want us to look at. This hospital was reduced its level from level 4 to level 3, despite the fact that this particular hospital has all it takes to be a level 4 hospital. What I came to learn is that the main problem this hospital is facing is political interferences, so that some political bigwigs in this country can create an avenue of creating private hospitals that only benefit either people who are in their support or people who are sympathetic or people who actually listen to what they say. And because it happens that the private operator of this particular hospital does not subscribe to the ideologies of this regime has decided to frustrate the hospital. And I wanted, there was a story about a young kid. Let me just read for you the story so that you can understand the reason why I have to come here and clear the air about what happened. This story happened on July 13th, 2025, where one particular patient was issued with a referral to a public facility from this particular hospital, but he was unable to secure a bed in a public facility as opposed to a private facility. And this particular patient was dependent on ventilation. And therefore, the transfer of this patient without an end-to-end medical care service was risky. And therefore, the management of the hospital, upon sitting with the parents of this child, who is a patient, decided to provide medical care for this particular patient, even without them paying, because they were unable to pay the needed amount. At KNH, they had tried to treat this patient, but it bore no fruits. And there was a story that this patient had been detained at the hospital for not paying. This case was reported on the media on July 29th, 2025. That was 2 weeks after the referral was initiated. The media did not cover these facts that we are telling you now in their reporting. And therefore, the private owners of this hospital are saying that they were unfairly, the report that came out was biased. And Kenyans, there is a need for you to dig deep and get to the gist of the story, before we make a conclusion, or victimize a facility that is actually very considerate to the needs of the patients. And this also goes to the Minister for Health, who in one way or another should be answerable to this particular issue, because the KMPDU officials are the ones who are at the hospital and reduced the hospital from level 4 to level 3. And there were reports in the media that the mother of the child was prevented from seeing this child, but the CCTV footage and nurse logs confirm that the visitations was granted in accordance with the ICU policy. Therefore, the reporting that was done on the media was misleading, and there is need for Kenyans to know the truth, because this is an injury to the reputation of this particular facility. And in accordance to this particular facility is committed to transparency, oversight, ethical profession, and it is open to any investigation that can unravel this issue. And so I'm actually urging the media to go back to this facility and get the story right, because it can amount to mislead and intentional sabotage of private medical care providers. And the Minister for Health should make sure that such kind of happenings do not take place in the country, because health is not something that you can come and gamble with. Health is a very big issue in the country. Health is something that does not need any political interferences. Therefore, I call upon all the people who are charged with the responsibility of providing these kinds of care, stakeholders, the media, the owners, and the parent of the patient in question, to come forward and clear the air of this whole matter. Thank you very much. God bless you.